My name is Dr. Deborah Kinnear, and in this presentation I will talk about the prevalence of physical ill health in a cohort of adults with learning disabilities in Scotland. The Keys to Life implementation framework made a call for urgent action to address the health inequalities experienced by people with learning disabilities. It highlighted that we need to have a better understanding of the health problems faced by people with learning disabilities and how we can improve their health and their well-being. There is likely to be a different pattern of health problems in people with learning disabilities. This can be different things including genetics and lifestyle. Most studies on physical health have methodological limitations, for example, being small scale, focusing on selected age groups or levels of disability. There are also few studies from the UK, and in the case of certain physical health problems, there are no studies at all. Therefore, the aim of this study was to report the physical health conditions of adults with learning disabilities. We carried out a large prospective cohort study which included adults aged 16 and over with learning disabilities born with and without Down syndrome who underwent a full detailed health assessment. We wanted to find out what are the most common physical health conditions and also what is the extent of multimorbidity, that is, having two or more conditions for this cohort, as multimorbidity requires different management approaches compared with single disease care pathways. In terms of the characteristics of the people taking part in the study, 1,023 adults consented to take part, 65.5%. Their average age was 43.9 years, so ranging from 16 to 83 years of age, and 18.2% had Down syndrome. 38.9% had a mild learning disability, 24.2% moderate, 18.9% severe and 18% profound. And there were slightly more males than females. In terms of living accommodation, 38.1% lived with a family carer, 10% lived independently, just over 45% lived with paid support, and 6% lived in a congregate setting. So moving on to answer the research questions. So what are the most common physical health conditions? So here we tabulated the top 20 physical health conditions, and vision impairment was the most prevalent, reported by 47% of the cohort. Epilepsy was the second most prevalent and constipation was the third. So what does this information tell us? Well, it tells us that over a third of this cohort experienced painful conditions such as osteoporosis and musculoskeletal problems. Almost a third experienced disabling conditions such as vision impairment and hearing impairments. And almost a third experienced potentially life-threatening and painful or disabling conditions such as constipation, hypertension and obesity. So all of these conditions impact on the quality of life of people with learning disabilities. And from the table you can see that most of these conditions are amenable to treatment. We broke the prevalence down further to look at those with and without Down syndrome and found that there were some conditions that were much less common in adults with Down syndrome. These include epilepsy, ataxia, cerebral palsy, osteoporosis and hypertension. So this highlights that there are variations within different subgroups of the population with learning disabilities, such as those with Down syndrome. The second question we wanted to answer was, what is the extent of multimorbidity for this cohort? In figure 1, you can see along the x-axis is the total number of physical health conditions recorded for people with learning disabilities from the health checks. And the y-axis tells us how many people were reported to have that number of conditions. As you can see, the mean number of physical health conditions was as high as 11, and more than 30 people with learning disabilities had 20 or more physical health conditions. What we need to remember is that this is a group of adults with a mean age of 43.9 years, adults ranging from 16 to 83 years of age. You would expect to see slightly higher numbers of physical health conditions in the older population, but these are figures that are spread across the entire adult life course. Almost all participants, 99.2%, had at least one condition reported, and 98% had two or more conditions. We looked to see if there were any differences in the extent of multimorbidity for the adults with and without Down syndrome. And as you can see from the graph, the extent of multimorbidity was similar in both groups. To conclude, This is the first study to report on multimorbidity in people with learning disabilities across the adult life course in a large base population sample where each individual had their health comprehensively checked. Multimorbidity is important as its management is more complex than that of single conditions, and factors such as the way drugs interact with each other and the way that drugs interact with certain diseases introduces complexity, and healthcare services care pathways are organised on single diseases. The list of the most prevalent health conditions in adults with learning disabilities differs from that seen in the general population, for example, diabetes and heart disease. So the recent work to better understand and address multimorbidity by Barnett et al. In 2012 does not transfer readily to the population with learning disabilities. The extent of multimorbidity in the adults with Down syndrome was similar to adults with learning disabilities without Down syndrome, but patterns of disease clusters differ. Many of these conditions are painful, disabling and/or life-threatening, and in the main they are amenable to treatment if high-quality care is provided and multimorbidity taken account of. Our findings are both novel and important and ultimately have significant implications for service planning and development. It is vital that healthcare professionals and carers have increased awareness of commonly occurring conditions in adults with learning disabilities, so that they can identify and report physical health conditions in a timely manner. Doing so will prevent individuals with learning disabilities suffering potentially painful and/or disabling conditions unnecessarily. Any policy initiatives or guidelines on multimorbidity need to be relevant throughout all stages of adulthood in people with learning disabilities. Health check programmes need to include checks for the most common problems experienced by people with learning disabilities and not based on the general population.